It is Hispanic and Latin American Heritage Month, and we're looking at how to improve disparities in healthcare in Latino communities. Dr. Edith Bracho Sanchez, pediatrician near Presbyterian Hospital, Columbia University, joins us now. Welcome back. Explain what's going on here.
So much is going on, George. These disparities are affecting so many in the Latino community. To give you a sense of what we're talking about, Latino adults in this country continue to have higher rates of obesity, hypertension, diabetes, chronic kidney disease. When we look at women, we're talking about higher rates of cervical cancer, lower rates of breast cancer screening, meaning that if and when we are diagnosed, it happens to be later in the stage of the disease. When we look at kids, we're talking about kids that are diagnosed with developmental delays, not always getting the care that they need, and all the things that are happening in adults are also happening in kids now. And we didn't get here overnight, George. This has been going on for decades. We know that Latinos have lower rates of health insurance, which makes it harder to access care. We also know that there aren't enough people who look like me, so there are language and cultural barriers to accessing medical care in this country. We work in occupations that are more dangerous. We also have higher rates of food and housing insecurity, and we are the targets of mis and disinformation. George, a lot going on.
So a lot of reasons there. Andrea from Connecticut has a question. Let's take a look.
I have an Asian parent at home who does not speak English. Oftentimes when she goes to the doctor, things get lost in translation. What do you suggest I do to ensure she gets the quality of care that she deserves?
Andrea, your parent is entitled to a translator. All of us are. And the next best thing, if there isn't a translator available, is FaceTime a relative or have someone join, come with you to the appointment so that you are crystal clear on your medical care. It is so important.
It's important that we all learn to advocate for our health.
There's so many things we can do, George, to be good advocates for our own health. The first thing is find a doctor that communicates well, that is listening. If that's not happening, find somebody else. Ask questions. You should be crystal clear when you leave the office on your treatment plan. If they're not answering your questions, put your finger right on it. Say, you didn't answer my question. You also should be tapping into community resources and find sources of verified information. George, I've come to terms with people going to social media for their medical information. Find good people. I'm on there, Dr. Edith. On Instagram. I mean, I'm posting in both English and Spanish. There's so many of us that are really doing good work to meet people where they are. That's social media these days, so be it. Find us, we're there.
Thank you for coming in.